Hello, my name is Dr. Kelly Wood. I am a pediatrician at the University of Iowa Stead Family Children's Hospital. I want to welcome you to this presentation of the Suicidal Adolescent Family Empowerment Program, also known as SAFE. We created this program to empower and partner with families to prevent suicide. We know that this can be a challenging topic, and we hope you find this information helpful. This program is for educational purposes only. It does not replace the advice of a medical provider. If you or someone you know is experiencing a mental health emergency, please call or text 988. If it is a medical emergency, please call or text 911.
Hello, my name is Ashley Mills, and I'm a licensed independent social worker. I would like to welcome you to this session of the Suicidal Adolescent Family Empowerment Program, otherwise known as SAFE. This program is designed to provide basic information for caregivers of youth who have struggled with suicidal thinking or may have even attempted to self-harm. In today's presentation, we will provide general information about suicide, talk about caregiver coping and communication, provide safety strategies, and discuss issues related to privacy, electronic safety, and bullying. We will define crisis prevention planning and provide a brief overview of dialectical behavioral therapy. We offer a brief mindfulness exercise at the end of this presentation and have included links to additional resources. If you are a caregiver to an adolescent who struggles with suicidal thoughts and/or self-harm behaviors, know that you are not alone. Suicide is one of the leading causes of death among children and young adults ages 10 to 24 years old. A national study conducted by the CDC found that about 20% of high school students seriously considered attempting suicide within the previous year. Keep in mind that suicidal behavior is often a byproduct of an underlying issue, such as depression, traumatic stress, anxiety, and/or substance use, all of which are treatable conditions once they are identified and properly diagnosed. Research has also found a strong association between family stressors such as divorce or parental conflict, relationship difficulties with a love interest, school-related problems like bullying, and suicidal behavior. While you as a caregiver are unable to control all of the variables that may lead your loved one to think about or attempt suicide, there are things that you can learn to look and plan for to reduce or minimize risk. While this may seem discouraging, there is hope. Statistics indicate that 9 out of 10 people who attempted suicide and survive will not die by suicide later in life. Prevention strategies, as we will discuss later in this presentation, can be an effective tool in reducing the likelihood that your child will engage in self-harm behaviors. Building resilience can also play a vital role in lowering the risk of suicide. Resiliency refers to teaching youth strategies to manage life's challenges in adaptive ways. A few ways to build resiliency in youth includes providing them with tools for emotional identification and regulation, teaching effective problem-solving and coping skills, and enhancing their emotional support network. Above all, encouraging open communication with your child about difficult topics is essential. Keep in mind that talking about suicide is not thought to increase the risk that your child will act on thoughts of suicide. In fact, it may lower the risk. One way that you can help your loved one who is struggling emotionally is to help them increase and develop what are known to be protective factors. Protective factors are conditions or attributes in individuals, families, and communities that help people deal more effectively with stressful events. They can be both internal, such as easygoing temperament or an overall positive sense of self, or external, like a strong social support system or school engagement. Some ways caregivers can assist their loved one in increasing protective factors are seeking effective care in your child's mental health and/or substance use, teaching your child healthy coping and problem-solving skills, and becoming involved in community supports, like a faith community or youth program. Above all, it is critical that you approach your loved one from a place of understanding and support. Asking your child, Why did you do this? May seem like a reasonable question when someone you love has attempted self-harm. However, the reality is your child may not know the reason or have the language to reflect his or her thoughts and feelings accurately. This can lead to increased feelings of sadness, frustration, and shame. While on the other hand, allowing your child space to process what has happened, engage with care providers, and letting them know that you will help him or her through this difficult situation, you can foster a sense of relief, hope, and trust. Some people believe that distracting your child from painful thoughts, impulses, and/or emotions will make them forget about what is bothering them. It is a basic human need to want to express emotion and to be understood by others. I often use the metaphor of what is commonly referred to as the pop bottle effect. When a person is struggling with intense emotions, thoughts, feelings, and/or urges, ignoring or suppressing them does not make them go away, nor make the person forget. Instead, there is a tendency for emotional pressure to build, much like what happens by shaking a pop bottle. When emotional pressure becomes too intense, it is like the lid of the bottle has been popped off. This is when anger outbursts, substance use, and/or harmful behaviors to self or others are more likely to emerge. By making time to allow your child to speak freely about what they are thinking or feeling, it may prevent that pressure from building and therefore lessen the likelihood that they will react in self-defeating ways. Being a caregiver of someone who struggles with mental health issues can be exhausting. As a caregiver, self-care is extremely important and not at all selfish. Some activities that promote a positive sense of self and adaptive coping include eating healthy, taking warm baths, attending yoga or mindfulness classes, and talking to a trusted friend or support person. By taking care of yourself, you are modeling healthy behavior for your loved one while also giving yourself a necessary break from the stresses of caring for someone who struggles with mental health issues. Another thing to keep in mind is that it is normal to have a wide range of emotions when someone you love is thinking about or has attempted self-harm. There's no such thing as a good or bad feeling. They just are, and they exist to give us information, even the uncomfortable ones. It may be helpful to think of your feelings as little individuals that exist inside of you, each one with a different story or perspective. And what they want is to be addressed by their real names and given a chance to speak. For example, anger wants to be identified as anger, not frustration. Just like happy does not want to be called glad or pleased. So the first step in coming to terms with what has happened is by correctly identifying your emotions, acknowledging them, and finding a healthy way to express them. Common feelings that caregivers experience after a loved one has attempted suicide can range from sadness and fear to indifference and even anger. Remember, you are not to blame, and you may find counseling or therapy services helpful in learning to cope with what has happened. People often ask, what do I tell others? The bottom line is, the decision about what to tell other people is unique to each person and family. Some families limit how much they share with others, while others find sharing their experience is helpful. We recommend that caregivers inquire with their loved one about their level of comfort, what they would like shared, and with whom. Some youth may not feel comfortable sharing this information. Therefore, it is important that their input is sought. Mental illness is still very misunderstood in our culture, and sharing this information without your loved one's input or consent may lead to unintended outcomes, like peer-to-peer teasing or bullying. Therefore, it is important that you, as a caregiver, listen and support their decisions, even if you may not understand their reasons. When making decisions about how to talk to siblings about what has happened, let your child know that their siblings care about them and are asking questions. Seek their input on what you will share. When talking with siblings, it is recommended that you choose a time when you are not overly upset. While showing emotion is inevitable and encouraged, children can be frightened when they believe the adults in their lives are not in control. We recommend that you provide the children truthful information that is appropriate for their age and developmental level, as well as explain mental illness in direct language that they can understand. If you have questions about what is appropriate for which ages, you may consider consulting with your child's doctor or treatment team. We encourage you to try and answer any questions that may have, but avoid unnecessary details, as it may frighten them. It is advisable to allow siblings to speak freely about their feelings and concerns and give them space to process their emotional responses. Assure them that it is not their fault and that you and their sibling love them. Let them know that their sibling is getting help for their emotional health issues and that help is also available to the family. Now let's shift gears and talk a bit about safety planning and why it's important. While it is true that we can never 100% guarantee safety, we can seek to lower the risk of a self-harm event, whether the event is impulsive or planned. You may be wondering, how do I do that? It is important to understand that you cannot completely control what youth will do. You can, however, make harmful behaviors towards self or others more difficult to engage in by removing and locking up items that could lead to dangerous situations. You can also put plans in place to support your child in the event a crisis arises. The goals of safety planning are always to increase safety and lower risk. Remember, the goal is to increase the time between thought, feeling, urge, or action, as well as increase the distance between your youth and access to means of self-harm. Time and distance are your best friends. The more time it takes for your child to find a dangerous item, the more time there is for you to coach or intervene. In times of extreme emotional distress, our brains are not functioning normally due to biochemical changes that shut down the part of the brain responsible for making rational decisions. The more time there is between a child's thoughts or urges of self-harm and physical access to harmful means to carry out the impulsive or self-harmful behavior, the more time there is for the child to cool off, begin to think more rationally, and make an alternate decision. Overdoses are by far the most common method of a suicide attempt. Items most often used for overdose or ingestions are medications, drugs, alcohol, cleaning agents, insecticides, gardening agents, and antifreeze. Some medicines are much more lethal in an overdose than others, but any medicine or combination of medicines in high amounts can be harmful or lethal, including over-the-counter medicines such as Tylenol, ibuprofen, and cold medicine. As a caregiver, you can remove or lock up all poisonous agents, such as medications and household or garden chemicals. It is advisable to keep only a limited supply of these items in your home and store them in a lockbox. When you lock and dispense all medicines, either prescription or over-the-counter, you can monitor who is taking what medication. Caregivers should control and manage their child's medicine by giving it as prescribed, watching them take it. Please note that youth may overdose on any medication that they can get, even if it is not theirs. Therefore, all medications should always be accounted for. In times of emotional distress or crisis, youth should not be in charge of their own medications. Sharp objects can also be used as means of self-harm. Some items that are used to engage in self-harm behavior are listed on this slide and can include anything from knives and razors to paper clips and pencil sharpeners. Items most often used for suffocation and strangulation include things like plastic bags, belts, bed sheets, ropes, scarves, and even shoelaces. It is strongly recommended that you completely remove the most dangerous items from your home. Caregivers should remove or lock up all sharps and potential strangulation items. Understandably, this can sometimes present as a challenge in managing everyday life. Another option, although less safe, is to limit the number of knives or strangulation items available to your child. The goal is to make it easier for you to notice the missing items. Another suggestion is to think about alternatives such as using electric razors rather than bladed ones, or items with shorter or limited cords. Or perhaps you can develop a check-in and check-out system which will help you monitor potentially harmful items your child can access. It is also important to understand that elaborate setups from high places are not needed to die by strangulation. The only thing that is needed is leverage, such as a doorknob or bedpost. Room searches and check-ins, which we will talk about shortly, can help you monitor your child's activities and assess for safety-related concerns. Firearms are a serious threat. Most youth who die by firearms use a family member's gun or rifle. Consider that 85 to 90 out of 100 suicide attempts by self-inflicted gunshot wounds end in death, as compared to 1 or 2 out of 100 overdoses, cutting, or stabbing self-injuries. When firearms are not easily accessible, suicidal people are most likely to delay an attempt or resort to less lethal means, which is why it is important for you to think about all firearm access your child might have in your home, as well as the homes of other family or friends. If you have a loved one in your home who is struggling with suicidal thinking and/or urges, it is imperative that you completely remove the guns from your home and car. You might consider having friends or relatives store them at their homes or seek a gun storage unit. Lock boxes, safes, trigger locks, or cable locks that have key restrictions at home are also options. Whichever option you choose, be triple safe. Store your guns unloaded, either in a locked box or gun safe, with the ammunition stored in a separate place. The bottom line is, suicide attempts by firearm is a highly lethal means that often results in death. Other safer storage strategies for hazardous material or weapons include using a lockbox to store the materials, choosing a careful hiding place for your lockbox, and storing the key and combination in a separate place. You should maintain the assumption that your child knows where the key and box is hidden. Change the combinations frequently and store lethal combinations of items in a separate place. The main goal of restriction is to remove all concerning items from the home. Adolescents have a normal and developmentally appropriate need for privacy. In periods of high risk, parents may have an impulse to limit private time out of fear of what their child may do. This can become a source of tension between the caregiver and child, which could escalate to upsetting events. It is important to find ways to offer privacy while still ensuring your child's safety. One way to enhance safety is by safety-proofing your child's room, conducting room searches, and parent check-ins. It is recommended that you resist the urge to remove doors from the rooms by taking steps that will ensure that the child's door does not lock is encouraged. Room searches should happen at the caregiver's discretion, but never without the child's knowledge. You can tell your child why the search is needed in the moment you are prepared to conduct one, but we discourage giving advanced warning to limit the opportunity for your child to hide potentially harmful items. Offer your child the opportunity to be present during the room search and share that you prefer complete honesty. You can let them know that you would prefer that they hand over or share concerning items rather than finding them on your own. This will promote honesty and trust between you and your child. After conducting a room search, thank them for their honesty and commitment to their own safety. The reality is that your child will likely want to spend time alone in their room following a self-harm event. As a parent, you have a right to check in, but should always knock before entering. You can decide how often the check-ins are needed on a case-by-case basis. If your child is in immediate crisis or has attempted self-harm, check-ins are recommended to be completed every 15 to 30 minutes. This can gradually decrease over time and occur less often when your child is more stable. It is important that you set expectations prior to conducting room searches. For example, when a parent knocks on the door, the child must answer in an appropriate amount of time. If the child does not answer in a reasonable time frame, such as 5 to 10 seconds, the parent may enter. Please understand that your child may have strong feelings about this and may become angry. Some people find it helpful to set the guideline that during a room search, there will be no talking or that signals can be used. For example, if you enter the room and simply hold up your hand, signaling a room search is about to occur, unnecessary conflict may be avoided. Let your child know that the overall goal is that you make visual contact to ensure they are well. If your child has been hospitalized following a self-harm attempt, these expectations can be outlined in the crisis prevention plan, which we will discuss later in this presentation. Appropriate electronic use needs to be taught to your children. Internet, social media, and phone safety should be talked about regularly. Some safety strategies for online use include advising your child never to share passwords or personal information online due to risks involved. Reminding them that once you put a photo or comment in cyberspace, it will always be in cyberspace. Setting the expectation that they not blindly trust people that they meet online, and understanding that schools have policies about cyberbullying, and encouraging open communication between you and your child about bullying and harassment. The first step in combating this important safety issue is to keep open lines of communication with your child, which will increase the likelihood that they come to you should difficulties arise. So what is bullying? Bullying has been defined as unwanted aggressive behavior among school-aged children that involves a real or perceived power imbalance. Power imbalances occur when one person believes that another person could harm them physically, financially, socially, or emotionally. Bullying behavior is often a repetitive behavior or has the potential to be repeated over time. It is estimated that about 1 out of 5 high school students report experiences with bullying every year, while 1 out of 6 report being the victims of cyberbullying. There seems to be a significant relationship between bullying and an increased risk of youth developing depression, anxiety, and intense feelings of sadness or loneliness. This is often observable by changes in sleep and eating patterns, school avoidance, health complaints, and loss of interest in activities they used to enjoy. There may also be changes in their academic performance, school engagement, or avoiding or dropping out of school altogether. We have listed some resources for your reference if bullying is an issue for your child. So we have talked a little bit about safety planning and have discussed a variety of ways you can safety-proof your home. Crisis prevention plans, like the one shown on this slide, are useful and helpful to diffuse difficult situations and prevent them from reaching a crisis point. Crisis prevention plans are not a solution to the crisis if one occurs, nor a guarantee that a crisis will not occur, but rather a guide to help you and your child develop a concrete action plan for use in times of heightened emotional distress. Please take a moment to review this slide, which outlines a crisis prevention plan. An effective crisis prevention plan will include information about activators, warning signs, skills, actions, and support. Activators are events or situations that lead to negative or troublesome feelings and behaviors. Warning signs are things that show us a situation is headed in a negative direction and needs immediate attention. Skills are things that we can use to help ourselves in times of emotional distress, while actions are those steps we can take to help support our child. It is also important to identify your support team. These are the people that can be called upon to help manage a situation should it reach a crisis point. If your child has attempted suicide and has been medically stabilized, a continued hospitalization in a child psychiatry unit may be required. If your child's hospitalization is extended, the child psychiatry team will likely conduct a family team meeting and assist you and your child in completing a crisis prevention plan prior to discharge. In this meeting, specific concerns will be addressed, goals will be established, and an aftercare plan will be created. You and your child should be provided with a written outline of this plan to refer to in times of crisis. If an inpatient admission to a child psychiatry unit is required, your child may also be coached in dialectical behavioral therapy, commonly referred to as DBT. You may be wondering, what is DBT? DBT is an acronym for dialectical behavioral therapy. The term dialectical refers to the idea that two opposing ideas can both be true at the same time. And when thought about together, there is a potential to create a new truth and thus develop a new way of thinking about a situation. An example of using dialectics may be as follows. A child has a fight with a sibling and thinks, "My sister is mean and doesn't care about me." Looking at the situation from one perspective can produce what is called all or nothing thinking. We had a fight and my sister is mean and she doesn't care about me. Using dialectics, the child may be coached into thinking about times when their sister has been caring. The child then identifies a time when their sister helped them with their homework. From a dialectical perspective, we can assist the youth in altering their thought process. In the context of this example, the youth may consider that although they are fighting right now, their sister has been helpful when they needed her and does care. This can jolt the child out of the all or nothing thought loop, allowing space for an alternate perspective to be explored. This generates change in the child's thoughts and their feelings about the situation, and by doing so, reduces their own emotional suffering. This technique encourages youth to practice cognitive flexibility by teaching them that there is often more than one way to think about a situation and promotes perspective taking. Dialectical behavioral therapy is widely regarded as an effective treatment for people who have a hard time controlling their emotions and or behavior. It seeks to teach you to replace problem behaviors with skillful ones and offers them skills to experience and tolerate a wider range of emotions without acting on them. It introduces skills to help teens effectively navigate relationships and their environment. DBT can help youth understand that life is worth living, even when facing challenging events. Dialectical therapy skills training includes identifying target behaviors to decrease that can lead to harm to self or others, and or interfere with daily functioning. These behaviors can include suicidal ideation, self-harm, substance use or misuse, risky behavior, and or impulsivity, to name a few. One component of dialectical behavioral therapy includes mindfulness practice. Practicing mindfulness can give youth more choices and control over their behavior, and helping them slow down and notice emotions, thoughts, body sensations, and or action urges. Mindfulness increases self-awareness and can help youth learn to choose a behavior more thoughtfully rather than act impulsively, which often makes situations worse. Mindfulness can restore a sense of pleasure in life and enhance a sense of emotional well-being while reducing emotional suffering. Being mindful can help youth in making important decisions and balance overly emotional versus overly logical decisions. Mindfulness can help focus attention, which will assist youth in being more in control of their mind rather than letting their mind or emotions be in control of their decisions. Practicing mindfulness has been shown to increase one's capacity for compassion towards self and others. It can also be useful in lessening physical pain, tension, stress, and improving overall health and performance. Mindfulness is a skill that, if practiced daily, even for 3 to 5 minutes, can reduce anxiety and depressive symptoms. The foundation for mindfulness practice starts with the breath. An important part of mindful breathing is to breathe from the diaphragm. So I would like to invite you to practice with me today. Let's start by planting our feet firmly on the floor. Pelvis gently tucked. And roll your shoulders all the way up to your ears, resting them gently down your back. Take a moment to center yourself and gently elongate your neck, resting your hands on your lap. Next, I'm going to invite you to take a series of breaths. When you take a breath, inhale deeply through your nose, filling your belly up with air as if you were a balloon. And slowly exhale through your mouth, releasing all of the stress or tension you may be feeling. As you close your eyes, knowing that there is nothing you need to worry about or do, just for these few minutes. Inhale slowly through your nose. And exhale through your mouth as you draw your attention inwards. And one more time, inhale, belly up with air, and exhale as you feel yourself relax and let go. Now allow your breath to fall into a slow but steady cadence. As you place your awareness to the top of your head. And notice any sensations that are present. If you notice any sensations or emotions, try not to resist or reject it. Just be open to whatever arises. Notice it and allow it to drift away, as if it were on a cloud drifting across the sky. Take another deep breath. Bring your awareness down through your forehead, in the back of your eyes, into your jaw, your mouth. Breathing gently. Notice any thought, feeling, urge, or sensation that arises without judgment or urgency. Now bring your awareness into your neck, down into your shoulders, into your chest, upper and lower arms, into your hands, inhale slowly, and as you bring your attention into your abdomen, your pelvis, your upper legs, shins, calves, and feet. Take a deep breath in through your nose and exhale through your mouth. With your next breath, I would invite you to envision breathing in a healing light. And as you continue to breathe in, allow the light to get brighter and brighter, radiating all over your body. As the light grows stronger, allow it to energize and heal any source of pain, tension, anxiety, or discomfort. We will sit here for a few moments, allowing this bright light to wash over our whole bodies, breathing in the light and exhaling any stress, strain, tension, or discomfort you may have. Take a deep breath in and exhale through your mouth. Take another deep breath in and exhale through your mouth. One more time. Deep breath in and gently exhale. As you slowly bring your awareness back into the room, and when you feel ready, gently open your eyes. If you are interested in learning more about ways of managing stress, we offer these free online yoga-based relaxation videos facilitated by Dr. Betsy Rippentrop, PhD, who is a licensed clinical psychologist and certified yoga instructor. These free videos can be accessed by clicking the links provided. You will be prompted to enter a password, Namaste. We would like to invite you to complete a program evaluation. Your feedback about your experience or suggestions for changes are greatly appreciated. We hope that you have found this information helpful, and we thank you for taking the time to learn more about safety strategies and positive health habits for you and your family. Here are some helpful links to additional online resources.
The University of Iowa Healthcare Department of Psychiatry also has resources for adults. They offer STEPS and DBT groups. Both are designed to assist you in learning a variety of strategies to enhance your own coping and problem-solving skills. If you would like more information about getting involved with these groups, contact the Adult Psychiatry Clinic. You can call 319-353-6314 for more information.